Well, welcome back to the Daily Brief on Metro Milwaukee's Health and Economy, brought to you by the Medical College of Wisconsin and the Metropolitan Milwaukee Association of Commerce. I'm Tim Sheehy, president of the MMAC, and I'm joined by my co-host, Dr. John Raymond, president of the Medical College. Each day at 3:30, we deliver a fact-filled 19-minute update on the health and economic impact of COVID-19. This webcast is powered by Aurora WDC. We're also joined by a special guest today, Dr. Jeanette Kowalik, who is the Commissioner of Health for the City of Milwaukee and very busy, so we appreciate her joining us today. Dr. Raymond, I'll let you take it away.
Thanks, Tim. Last week, we showed some data that suggested we were beginning to flatten the curve here in Wisconsin and in Milwaukee. Recall that our daily growth rate of new COVID-19 cases dropped from over 30% about 10 days ago to below 20% last week, and the doubling rate of COVID-19 cases stretched out from 3 to 4 days. Today, there were 67 new COVID-19 positive tests in Milwaukee and 138 in Milwaukee. The daily growth rates were favorable, dropping to 12.6% in Milwaukee and in Wisconsin, and the doubling rate showed a favorable trend, and we're at about 5.5 days, both in Milwaukee and in Wisconsin. Now, for those of you who follow the City of Milwaukee Health Department's outstanding website, you'll note that the numbers on this slide are slightly different than those. This is due to a timing issue and doesn't change the key calculations or the conclusions. So this is good news, I think, that the trend continues to be favorable. I'd like to express my appreciation to all of you and to everyone who's making sacrifices to flatten the curve. You are making a difference, but we need to see this doubling rate stretch out to 7 days and even beyond if possible, because local projections still suggest that our Milwaukee health systems will reach the capacity of ventilators and ICU beds within the next week to 10 days. We need to continue to push hard as we possibly can. And again, what we do now will impact what happens 1 or 2 weeks down the road and will help us get closer to a recovery phase for the health of our community and economy. And what I'd say is I'm beginning to be cautiously optimistic that we might be able to not have a surge that exceeds the capacity of our ICUs and ventilators, but that story is going to play out over the next week to 10 days. If we could go to the next slide, please. The next slide shows the daily new COVID-19 positive cases in Wisconsin. Now, the mathematically modeled trend line is depicted by the middle curve, and that shows continuing increases in COVID-19 positive cases. The two outer curves are simply the limits of confidence of the model. Now, other models do suggest that we're going to peak within 1 to 2 weeks, then plateau and decline. Indeed, if you look at the variability in the day-to-day numbers, the eyeball test might even support that we're beginning to plateau now. And I can assure you that we will be monitoring that closely each day. But I want to emphasize that with continuation of social distancing, we do expect to be moving into a recovery phase within the next few weeks. We can't let up. To get there, we have to prevent that surge that overwhelms the capacity of our health systems to give the best care to everyone who needs it. And that really means intensive care unit beds and ventilators. Now, the next 2 slides are provided there for your information to summarize issues and questions that we will begin to consider as we anticipate what lies ahead for us as we move through this first wave of COVID-19 in our community. The slide after those 2 gives you some basic information about COVID-19 tests that we talked about in previous briefs, and those are available to you for your consideration. Now, I'll forego any further discussion to make time for Commissioner Kowalik. Thank you, Tim.
Sure. Dr. Kowalik, let me just start out by asking you kind of what you're seeing in this data. And as we've looked at this data every day, and I look at the statewide data and Milwaukee County's map, it looks like Milwaukee County accounts for about 54% of the cases statewide. And that when you break down the Milwaukee County numbers, as you've been focusing on them, 45% of those in Milwaukee County that have been impacted by this are African American, and about 70% of the deaths in Milwaukee County have been African American. So this is hitting a part of our community in a really, really challenging way. So I'm very interested in your insights.
Yes, thank you for the opportunity to be on this call or meeting today. Thank you, Dr. Raymond, for providing some of the projections of this is what is important to public health. We use a lot of math and science to try to figure things out, just like you would in finance or any other industry. So it's important for us to prepare for what lies ahead. Now we have a curveball. There's an election going on right now, and this election can compromise our efforts because just like our Safer at Home order, which is Governor Evers' Executive Order 12, which focuses on prohibiting congregation and focusing on essential functions, although the election is considered an essential function. But an in-person election compromises our ability to continue to flatten the curve or smash the curve. So we should be looking at this data from today and seeing what ends up happening. If we're going to see another peak, another spike, is this going to set us back? We anticipate that this will. We're also concerned about some voter suppression that comes out of this, where we have people that have limited transportation that are used to using their polling sites in their neighborhoods. Again, there's 180 polling sites throughout the city of Milwaukee, and they have been consolidated to 5 sites, and anticipated attendance is 10,000 people at each site. One of these sites is located in an area that is considered a hot spot, which is my old high school, John Marshall. And it's very concerning because, the whole rationale for consolidating these sites was related to a shortage of poll workers. As you know, many of the poll workers are longtime volunteers that are retired folks that are considered high risk because of their age or underlying health conditions. So all of those individuals had to be pulled offline, and then other people had to be brought in to fill the gaps. So we're concerned, how this is impacting the diversity and right to vote as well. So it's a public health issue, but it's also a civil issue as well. But we don't, again, looking at these racial numbers, looking at the impact of COVID-19 by race and ethnicity is very significant for the city of Milwaukee and Milwaukee County at large, because now that there's more attention on this and we're looking at other jurisdictions across the country and we're seeing some similar patterns here. I keep seeing that 70% for deaths. Chicago even had reported the same. But then you're looking at why is this, right? So you're looking at some historical artifacts of segregation, redlining, and even today, like how structures of racism still play out in our economy and how we're able to try to move ahead as a community. So there's still a lot of work that needs to be done to dismantle that. And the city and county declaring racism as a public health issue last year was very important to first acknowledge that there's a problem, but then it enabled us to start assessing and looking internally, like what are we doing that's adding to this? What can we do to take away from these structures? Again, whenever you have a situation, a perfect storm, if you will, anything that's already stressed or fragile is going to be magnified. So that's what we're seeing right now. We're again seeing this in other jurisdictions across the country, and as more and more are able to provide the race and ethnicity data, we'll continue to be able to compare where we are at and what are some elements of our way of life here in southeastern Wisconsin that are similar to other places across the country.
Well, thank you for that overview, again, in some very, very challenging data for a good portion of our community. Chris, I'm wondering if we've got questions already from our audience.
Yeah, for sure I do. One for Dr. Kowalik, there was a follow-up on the idea of having a relatively limited number of polling sites. What was the sort of game plan behind that?
Again, the concern was related to poll worker capacity and the fact that so many people that had been online to work polls and they have their system set up and all of that those people couldn't work the polls. So consolidating the sites was necessary to be able to actually run the election. So in essence, there were questions about that, and Neil Albrecht is our commissioner of the Election Commission here in the city of Milwaukee. And just some of the consultation that went into making those decisions, the health department was involved with that. Even like the spacing and just the flow, and also providing health department clinical staff on site to do screenings if someone happened to present with symptoms, that they would be removed from the group, and that they would still be able to vote, but in a safe manner, but not infecting other people. So that was another element of running the election. We were preparing just in case the election happened today, so it wasn't like we were caught empty-handed, but it's still quite the endeavor to run an election in this manner.
Great, thank you. There's a couple of questions for both of you about what holding an in-person election might do to our curve and the potential to exceed the capacity of the medical system.
Yeah, we were very concerned about this. A number of the health officers from across the state signed a joint letter over the weekend and submitted it to State Secretary Andrea Palm, as well as many of our legislators, to identify the concerns where we're actually using the same as Dr. Raymond, the charts and the numbers that show this is what happens when you close schools. This is what happens when you close restaurants, like showing how orders impact and slow down the spread of COVID-19, looking at other jurisdictions and other places. So, you know, the modeling shows that we're going to have a spike because of this in-person election. And, you know, we're very concerned, but we know there were legal levers and things that we couldn't do. So I've received a lot of questions about this over the last 36 hours as the health commissioner. Why am I not canceling the election? And I legally didn't have the authority to do that because the emergency powers issued through the state secretary and the governor's office had limited the powers of local health officers. When Executive Order 12 was issued, there was 2 points to it. One was designating elections as an essential function of government. And then the second was that any other local orders that were similar would be overridden by the Executive Order 12. So that's exactly what happened. So my hands were tied. I was not able and am not able to override this decision.
Great, thank you. We also had a question about the risk-reward proposition for hydroxychloroquine.
Well, that's certainly a top of mind question. As a scientist, I would say that the data that it actually is useful as a preventive or as a treatment are really slim. On the other hand, there are some known side effects, but the side effect profile is relatively benign in the right doses. And for off-label uses, if a physician decides that that's something that they want to administer to their patient, they're free to do that. But I don't think in general, most of the health community thinks broad spanning use of hydroxychloroquine is a good idea.
Also had a question about whether we're seeing some improvement in the time it takes to get test results in the metro area here.
Well, Dr. Kwolek, maybe you want to start with your, since you're in charge of a lot of that.
Oh, yeah. So initially, the 2 public health labs, the State Lab of Hygiene in Madison and the Milwaukee Health Department lab here in the Central City, were the only 2 sites that were FDA approved to process COVID-19 specimens. And eventually that scaled up. So there's more labs that are online that they might have their own testing process or whatever. And then there's others that are private corporate labs that are out of state. So this is important because this impacts the turnaround time on receiving results. And as you saw in the journal, the one individual that said it took her 2 weeks to get her results. Well, my understanding is that is because that lab was sent out of state, and there is a backlog at that lab, so people are not getting their notifications right away. So I think it's important for patients to understand, depending where they go, where their lab's going, and recommending, if possible, to divert or request that labs are processed in state. And I can tell you that the Milwaukee Health Department lab can turn around lab results in 24 hours. But we're not a corporate lab. We're not a diagnostic lab. We're more of a surveillance lab, so we don't have the ability to run thousands of samples. We're more of, okay, we're going to most likely prioritize healthcare workers and first responders because we need to make sure folks are online. But just to give you a sense of the difference of a 24-hour turnaround time for a local lab versus an out-of-state lab that can take 2 weeks to get results back. So
I would only add that the health systems have been steadily ramping up their capacity to do tests, and the turnaround time is much better than a day now.
Very good. One question, what happens if we do reach or exceed the capacity of our medical system? What does that look like?
I want to be clear about what we're talking about with capacity. Right now, the limiting factor would be ICU beds and ventilators. The health systems in this region have increased their capacity dramatically. They've done it at the expense of other lines of business, which is, we're all feeling the financial pinch from that. Our revenues are down about 25% per month, but we did that to make room. So there's been a significant increase in internal ICU surge capacity. And like other health systems in the country, everybody's working very, very hard to repurpose ventilators from operating rooms and from other healthcare settings to be available for those ICUs. So what I would say is the health systems here have done everything possible to make sure that we mitigate against a surge.
Had another question about the temporary care facility at State Fair Park, when that might be online and how that might interact with the existing healthcare system.
I have a date for that. I don't know if Dr. Raymond, if you want to talk a little bit about it.
Go ahead.
Oh, okay. So the Marquis Healthcare Partnership is a group of all of the healthcare systems, federally qualified health centers, and public health for the most part. And the group has been meeting for a long time, but it's really important for us now to meet on a more regular basis. So as a part of that, we just met today and we got an update on the facility. And it looks like it will go live on April 21st. So our peak was moved up to April 17th, which is a few days difference, but I mean, April 21st is, you know, better than May 21st. So that there should be some additional support for a surge through that endeavor. So the Army Corps of Engineers is going to build out the space, and then we all need to provide the clinical support and equipment to provide medical care.
Dr. Kwolek, let me ask you a question. Can you envision a scenario where the state would lift its safe at home order and Milwaukee would decide that it needs to stay safe at home longer?
Yes, so when we actually issued an order, it was literally within 24 hours that the state order went out. And we were preparing because obviously we had the greatest number of cases and deaths at that point in time. So we were looking at this as a way to slow it down, to flatten the curve. So when we were looking at the timing of that order, we were looking at the length of the executive, the emergency order. So it's normally 60 days. So if the order went into effect on Friday the 13th in March, then it would essentially go to the second week of May or something along those lines. So we were looking at having an order that was consistent with the time of that emergency declaration, noting that those can be extended. But we were still looking at kind of being consistent or having some kind of parallel supports so that the public wouldn't be confused about when is something on or off. And then of course at the federal level, there was this push to have a short-term promotion for staying at home, and now it's extended to 30 days. So, you know, again, we're home rule, so we ideally should be able to do what's best for our communities, but in emergency situations, sometimes the state will override us. So that's always a consideration.
Well, thank you both very much for your time. We appreciate it. We'll dig into some of these issues tomorrow. In addition to Dr. Raymond, we'll have Bernie Sheehy, the CEO for Ascension Health, who will join us to talk a little bit about that health system collaboration. On Thursday, Mark Cass, the editor of the Business Journal, will bring his perspective in terms of what he's hearing from their readers and their subscribers. And then we'll close up with case trends for the week. And I believe we'll have the mayor back on with us Friday. So again, thank you very much, Dr. Raymond. Dr. Kwolek, thank you very much for your work. I know how taxing this has been on you, and we appreciate your leadership. And have a good, safe rest of your afternoon.
Thanks,
All right.
Tim.
Thanks all. Bye.